Hello, everyone, and welcome to today's webinar. It's all about revenue, myths, and orthopedic best practices. My name is Alex Goulding. I'm the Public Policy Manager here at iHealth and will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You'll have the opportunity to submit questions during today's presentation by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and, time permitting, address them during the Q&A session at the end of today's presentation. Also, please note that today's slides will be shared in a follow-up email after this presentation in case you want to review again or share with any peers. Before I introduce today's speaker, I would like to note that today's webinar is the second webinar of iHealth Innovation's MACRA Final Rule series. Please keep an eye out for our upcoming Final Rule webinars, including a MACRA Final Rule overview and additional specialty-focused webinars for radiology, primary care, and cardiology. I would now like to introduce Justin Barnes. Justin is a corporate, board, and public policy advisor. In addition, he's Chairman Emeritus of the HIMSS EHR Association, co-chairman of the Accountable Care Community of Practice, and partner at iHealth, where he assists organizations with industry strategy and leadership. Justin is also the host of the weekly syndicated radio show, This Just In, on Healthcare Radio and Business Radio X. Justin has formally addressed or testified before Congress, as well as the last two presidential administrations, on more than 20 occasions. He's appeared in more than 1,200 journals, magazines, and broadcast outlets. With that, let me turn today's presentation over to you, Justin.
Thank you very much, Alex, and thank you to everybody for taking time today to join us. We're going to try a new process here, and this is about a 30-minute webinar. There's just always so much content, so we usually run about an hour and 10 minutes or so, but we're trying this new format to 30 minutes. We're going to try to right around that and make it very high impact, a lot of good content, and obviously this webinar is focused on orthopedics. If you've ever heard me speak before, I do talk fast. I try to slow down from time to time, but I do like to cover a lot of great content. It's very strategic. It always helps your bottom line. I've been doing this for about 15 years now, and I really enjoy it. So hopefully you'll learn a little bit here over the next 30 minutes or so, and if we can ever help in any way, please feel free to let us know. But as Alex mentioned, I do a lot of work in the industry on Capitol Hill, and directly with care providers, practices, as well as hospitals and health systems. And before I dive in too deep, I do want to take a moment to address the local elections, or the elections that just occurred, the recent elections, with Trump and Clinton. MACRA and MIPS and the QPP, those programs at the end of the day are not going to be changed. That was a bipartisan bill that got passed back in 2015. Republicans and Democrats came together to really protect doctors' pay and find a fix for the flawed SGR formula, the sustained growth rate formula. It was something that was near and dear to my heart. I testified almost 10 times on that over 10 years. Just finding a solution so doctors didn't get that big 20% cut at the end of the year. We always found patches, but it just took up a lot of time to do that. So I was happy that Congress and the President were able to come together and find a fix and even create a 1% or a 0.5%, 0.5% increase starting in 2016 and then again in 2017 and 2018. So actually staving off that 20% cut that we had to fix every year, but with a pay increase for all eligible providers starting in 2016 of a 0.5%. And then you layer on the other MIPS incentives. It's certainly an opportunity to optimize your revenue and really make sure that you're flowing with how healthcare is moving forward. But I like to take a quick step back because and we're going to show you some of the MIPS calculations of how much money you can make under the program here in a couple of slides. But before I get there, it's very important to look at your revenue cycle overall, because when you actually dive in, certainly for the next 3 years, a significant amount, probably 90% of your additional revenue is going to come from optimizing your revenue cycle, optimizing your business practices and your efficiencies there, rather than coming from alternative payment models in the MIPS program. There's certainly some good money out there. I mean, PQRS and meaningful use, and then certainly those MIPS incentives, that'll equal up to anywhere from, $5, $10, $20, $30, $50,000 per provider, depending upon your specialty. in orthopedics, it's certainly a incentivized specialty to go for MIPS. But when you look at the grand scheme of how much money you actually can create in additional revenue to the bottom line, improved cash flow, 90% of that is going to come from creating a more efficient revenue cycle and optimizing your revenue cycle. So I'm going to go through what that means because it's hundreds of thousands of dollars for your average practice, and it's millions of dollars for your hospital. So it's something that's near and dear to my heart. I spend a lot of time trying to make sure physicians stay independent and only sell their practice if they really want to or need to. But there's just thousands of strategies. There's certainly hundreds of strategies that can be deployed to make more money, hundreds of thousands of dollars more to your bottom line starting now. And that's what I'm going to cover here first before we go into the MIPS program. So very important. I'll cover the revenue cycle aspects here in a moment, but also looking out at new services. And a lot of the tenets that I'm about to go through have nothing to do with just healthcare. It's just running a more efficient business. It doesn't matter if you're in transportation, education, construction, home building, whatever it is, healthcare. You can run a more efficient business, optimize your revenue cycle, look for partnerships, look for additional service lines, and certainly with healthcare, care delivery opportunities, and certainly ones that are specific to orthopedics. So there's lots of avenues, and this is something that I love to do and love to partner with hospitals and certainly practices on this accord because there's just so much money to be made here and opportunity to be had here. So when I talk also about some of these programs, it's not just about CMS. Today we're really going to focus on MIPS and what CMS is doing, but we work with all 50 states and certainly the Eastern Seaboard and a lot on the West Coast and in the Midwest on these programs that are state-based or community-based. So there's tons of programs, PCMH, which is Patient-Centered Medical Home. There's oncology programs. There's orthopedics programs. There's so many out there that can bring you quality reporting incentives and care delivery incentives that people don't know about. So, and there's just more on the way, much more to come in that regard. So we want to look at all of these programs. Also, look at patients as consumers. I'm sure you hear this a lot, but make sure your organization is easy to work with, easy to conduct business with. So that's aligning processes, that's aligning services. Look at innovation where you can. Ensure that in some specific strategies, ensure your patients can access scheduling very easily or make it easy to schedule appointments, answering the phone, or schedule appointments. Make it easy to visit your practice and not having to wait 45 minutes or an hour, but they're seen within 10, 15, 20 minutes. Realize things happen and sometimes patients have to wait longer, but that should be an abnormality, not the norm. Patients want to be in and out, and and obviously, and if you don't know this, patient satisfaction is going to be a significant portion of your pay and incentives moving forward. Anywhere from 5 to 15% of your incentives are going to be tied to patient satisfaction. So we want to make sure it's easy to schedule appointments. It's easy to have appointments and be seen by care providers and be seen by a practice and or a hospital. But also, very importantly, it's easy to make payments, for patients to make payments on their bills. There's a great product called PatientCo that allows patients to set up payment plans and receive bills that are very easy to understand, make it easy to pay, make it easy to collect money. So I think it's something, those are some very simple things that are just pennies on the dollar that can just bring you tens of thousands of dollars of more revenue or hundreds of thousands of dollars of new revenue. And that has nothing to do with your revenue cycle. I'm about to talk about some really cool revenue cycle items before I type into MIPS and the QPP program. But you really do want to optimize your revenue cycle. So when I say that, what do I mean? Really optimize documentation to mitigate issues and reduce risk. Specifically, make sure care providers are capturing and noting all the elements of the patient encounter. Make sure providers are capturing the right information at the right time in the right fields. You also want to update your EHR, and this is stuff that we do as well. We can come in there and show you some of these best practices and educate you and train, but also we go in there and actually edit. You can do this too if you're the experts on your team, but we'll edit an EHR template to reduce clicks and make sure it's capturing the right codes and that you're capturing the right information at the right time. This is where you can, when you look at how much additional revenue that we can bring to a bottom line, that's just in coding and accurate coding and comprehensive coding, we bring an extra 40, that's where we get 40% of our ROI. So if we can say, hey, we can bring in an extra $230,000 a year, well, 40% of that usually comes from coding and comprehensive coding and making sure documentation is accurate. And also clinical and financial alerts and reminders. There's a lot of things that we can do that are already inherent in your EHR. In most cases, most of the practices have all the technology that they need. It just needs to be optimized. And we actually go in there and make sure that your EHR and your dashboards are all set up perfectly to count towards whatever programs you want to participate in. Also on the documentation side, to make sure that you're not under-documenting and you're getting paid for what you're doing, but also on assessments and questionnaires and evaluation services, screening and tests, we can make sure that all that counts towards your MIPS. If it's not set up or if you're not timing and are having your EHR capture the amount of time that you're with a patient, well, then it can't count towards your MIPS and other quality reporting initiatives. But there's a lot that your EHR can do behind the scenes without extra work on your side to bring you more money. Not only will you make more money when you say that you're using the accurate codes on your revenue cycle today, but then it also sets you up for making more money under either PQRS, meaning fees, and certainly MIPS tomorrow. So a lot of opportunity there just on coding. Also, we recommend chart audits. In orthopedics, we recommend 10 per provider monthly or every couple of months by expert billers, not just the senior people who are doing your billing because they don't know what they don't know. But you have an expert biller come in there or a co-sourcing expert come in there and look at missing charges or look for missing charges on a consultation, or maybe there's no notes or wrong provider noted. There's down coding, up coding going on, or wrong ICD-10 codes there, or missing modifiers. This is all a lot of money left on the table, but also these prevent rejection, denials, and audits. And as I mentioned a moment ago, keeping the future in mind, optimize coding inside your EHR so you can qualify on PQRS, you can qualify for MIPS, any other alternative payment models or quality reporting initiatives. But keep the future in mind, and we do a lot of work on the front end to make the back end much more efficient. Managing credentialing, monitoring PAR and non-PAR care providers. This is where about 10% of the additional in the ROI that we bring to practices comes from credentialing. You wouldn't believe the games that payers play, or you would because you guys are you're providers, but you wouldn't believe the amount of money that we see by playing the game. We play the game with payers. We make sure that our providers are credentialed properly. We have one large health system in New York that the payer actually takes the physicians every month off the rolls. And we have to go re-credential every single month, every single provider. But it brought an extra $9 million a year, every single year now, to that health system. But we do that at the practice level, and it brings, maybe not millions, but certainly hundreds of thousands of dollars at times, or even $20,000 to $50,000 at times. So it's a great opportunity. It's where we find probably 10% of our ROI. Also, denials, and I'll talk about this a little bit later on, but managing denials and being tenacious, only 60% of practices follow up on only about 65% of their denials. They only have appeals on about 60%. Well, you need to appeal 100% of your denials. It's very important to appeal. We appeal 100% of our denials, and then even better so, we actually go in there and go to the root cause of the denial. So not only do we follow up on 100% of our denials, but we go in there through our analysis and technology and go in there and look for what is the root cause. So we mitigate those and eliminate those denials in the future. And also, you want to optimize collection through eligibility verification and the right process and best practices there, prior authorizations, and also very important to manage fee schedules. You want to look and balance these every 6 to 12 months to make sure that you're getting paid to what your contract says with each of these payers. On your screen now are a series of best practice examples for orthopedic coding. And these are just a random set of examples. We have dozens of these that we put forth to practices. But these are great ways. And when we go into an orthopedic practice for the first time, we find, again, 30 or 40 of these type of coding issues where their denials are too high or we can fix. So now, again, we're getting back to the root cause. We don't have those denials moving forward. And this is where we can go get, say, an extra $50,000, $100,000 of revenue that's left on the table every single year, and then sometimes every single month. So again, great opportunity for additional revenue to the bottom line for practices. And again, all of these slides are available to you to go through at your leisure. I only have about 30 minutes today, so covering a lot of ground kind of fast, understand that. But this is designed to make a high-impact presentation, so you guys can also go back and share these with your peers at your leisure and go through all these slides at your leisure. But now moving over to MACRA, MIPS, and the APM and the Quality Payment Program. So the bill was passed, MACRA was passed in 2015. We got the final rule October 14th. And the good news here, every provider within an earshot of me that can hear my voice right now should be just fine, certainly for option one, to stave off that 4% cut that's pending. So the only way you're going to get a 4% cut is if you totally ignore the program. But if you're taking the time to listen to this webinar today and to hear my voice, you are going to be just fine. Option one on reporting is so simple. It literally is report one quality measure or one improvement activity or 5 advancing care information measures over 90 days can avoid a negative payment adjustment. So literally it's so simple. If you've ever done PQRS, if you've ever done meaningful use, this is much simpler. So just one quality measure or one improvement activity or 5 ACI measures, advancing care information measures, over 90 days can avoid your 4% cut. So all those stories about the gloom and doom and the end of the small practice due to MACRA is false, untrue, and I'm happy to be able to tell you that. And I'm, certainly those stories are hopefully going away. It is very simple to qualify for MACRA and to at least stave off that 4%. Now, if you want to go for option two, which is to submit a mixture of quality measures and activities over 90 days or 180 days, you actually can start to move up and get maybe 1 or 2% increase. So not only will you not get your 4% cut, but you're also going to get maybe a 1 or 2 or even 3% increase in reimbursement. So a great opportunity there for option two. And now option three, practices that are ready to go. If you're using a leading EHR like eClinicalWorks, is a great product out there. I've seen their MIPS dashboard. I'm sure others will follow suit like Greenway and other good leaders. But, option three means practices that are ready to go January 1st with their MIPS certified EHR. Go in there and we'll set up your dashboards and you'll do your full 360-day quality reporting and capturing that information. So the right mixture of quality measures, improvement activities, and advancing care information measures over 360 days, you'll get your full 3 or 4%. All depends. We don't know exactly, but you'll be well on your way to having a solid 3-4% increase in pay. Option four, not going to spend a lot of time on that. That's less than 10% of care providers will qualify for option four. That's really the Medicare Shared Savings Track or the CPC Plus or the oncology tracks. There's some other ones that are out there, but most everybody that we work with on a regular basis are option 1, 2, 3, and certainly option 2 and 3 to get some additional money. First, from a stepped ladder perspective, first year you can get up to a 4% increase. Year 2 up to 5%, year 3 7%, and year 4 9%. And these are cumulative, so it's really going to add up. And we're about to walk through some calculators with you. But these also, if you totally ignore the program, you'll get a 4% cut year 1, a 5% cut year 2, and so forth. So you certainly don't want to ignore the program. It's very easy to achieve these incentives. I'm certain if you're the right partner. So now real quickly, I know I'm going fast. Again, all these slides will be available to you, just trying to cover a lot of ground in 30 minutes. But quality measures, and again, if you've done PQRS or meaningful use, you're very well prepared for where MIPS is going and where it's going to take you. So quality, 60% of your quality score will be based on quality measures, and 60% of your MIPS score will be based on quality measures. And I'm going to go through what those measures are here in a moment. I'll go through all of them, actually. Advancing care information will replace as meaningful use, and that accounts for 25% of your performance score. And improvement activities, which is a new category, and I'll go through all those measures as well and show them to you, that accounts for 15%. So you can add up 60, 25, and 15. That's 100% of the categories in your MIPS program. But again, if you just want to save up the 4%, you only need to do one quality measure. You only need to do one improvement activity or 5 advancing care information measures. So a lot of easy opportunity for your first year in 2017. So now, what does that mean? And to show the flexibility on the quality measure side, you only need to choose 6. And in orthopedics, you can choose from 21 measures, but you only have to pick 6. So it shows it's really, they want you to customize the program to your workflow, your specialty, and how you want to conduct your business. So again, you have 21 measures to choose from, and I'll show you those here in a moment. You only need to pick 6. On the advancing care information, you'll have if you have a MIPS certified EHR, you'll have 15 measures to choose from, and you only need to do 5. If you want to get your full or 3 or 4% increase, you need to really do all 15 measures. But if you just want to stave off the 4% cut and do the bare minimum, then you just got to do 5 required. If you're not using a MIPS certified EHR, you only need to do 4, and you have 11 to choose from, but 4 are required under advancing care information. In the improvement activities, you have 93 to choose from, and you only need to do 4. But if you want to get full credit, you actually will want to do more. You can do 4 for full credit, or 2 if you're in a rural or health professional shortage area. But you have 93 to choose from. So again, you want to pick, and this is what we do, is we'll come in there for orthopedics, and we'll actually offer you, hey, based on your specialty, based on your workflow, here are the 6 quality measures, or 6 or 8 to choose from. You only need to do 6. Or advancing care information, we'll give you the 5 best measures that are required, or the 4 best measures required, and then also we'll make recommendations on here are the 4 improvement activities for you to do based on your workflow and your specialty, in here orthopedics. And if you do all that, you're going to be getting a 3 or 4% increase. So it really is a great opportunity to make some good money here. So some key takeaways before I actually dive into all the measures. The program is very flexible. It's pick your pace. You can go for just to not get a payment cut, or you can try to go for a 1, 2, 3, or 4% increase in 2017. It's highly flexible based on your objectives and measures that you want to go for that fit your practice, your specialty, and your workflow. And also, it's not all or nothing. You can get partial credits and bonuses available, unlike meaningful use, which is all or nothing. So a lot of flexibility here. And also, it's important to note, in 2017 and 2018, you still need to go for PQRS and meaningful use. However, starting in 2019, those programs fully integrate into where MIPS is, and into the MIPS quality reporting program. So you no longer have to do those multiple programs, which is great. I put a 4-point MACRA success plan out there, which again, this will be shared. This is also all available on our website and social media, but we also embedded it into this presentation for you. But 4 simple steps to have MACRA success. I cover the revenue cycle side on a financial success. On the clinical success, I talk about setting up your EHR and make sure you're doing the right, have the right dashboards and pop health and care coordination. Make sure that you have, on the technical success side, the right EHR foundation and that your health IT is optimized. And then also staffing alignments where you need to, and also staff education. But again, a 4-point plan, we link right from here. And now diving into some of the specific examples for revenue opportunities. So for orthopedics, for an average 6-doc ortho practice, about $35,000. So pretty decent. It's about $5,000, $5,600 per ortho practice, per physician. And that's just year 1. Year 2 for a practice would go up to about $44,000, and then year 3, $61,000, and $78,000 year 4. So again, some good money on the table here. But when you look out over, and why I brought up the revenue cycle importance here, when you look at optimizing your revenue cycle, there's hundreds of thousands of dollars there to be had. So it's like a 90-10 split. Now, in 2020, 2021, 2022, when these incentives start to really grow much larger, then it's going to balance out. Half will come from optimizing your revenue cycle, and half will probably come from quality reporting. But for the next several years, starting in 2017 or even 2016, you really want to jump and get your revenue cycle tuned up. So much money being left on the table there. Now in orthopedics, if you look at cumulatively, because I told you these are all cumulative, $35,000 your first year, then $78,000, then $138,000, and $217,000 in year 4. That's a lot of money for a practice. And so again, this is why you want to take the program seriously. You don't want to leave any money on the table. Certainly you want to optimize your opportunity here. So now, here are the specific measures. Now, there are 21 to choose from. You'll need to do 6 under quality, but these are your specific orthopedic measures. I'm not going to be able to walk through every single one because I only have 30 minutes. But again, this presentation, you can pause this presentation. You can read each one. You can download the slide deck that we post with this. And again, review all of this at your leisure, or reach out to us. We'll be glad to help you and walk you through this program. But here are the 21. I'm actually walking through all 21 of the quality measures, and a lot of these you have and already incorporate in your daily flow with your patients. So these aren't all new measures that you've never seen before. A lot of them are part of, again, PQRS and other programs. So a lot of opportunity here for success for a practice. Again, you can pause the screen. You can download the slide. Share this around with any of your peers. And if you have any questions at the end of this slide, this presentation, I'd be glad to answer as well. So that was all 21 of your your measures under quality for orthopedics. Now outcomes measures, and you are going to have to do some outcomes measures. If for some reason there's not one applicable to you, then you can just go back and pick out the 21 for quality. But because you do have to do an outcomes measure if it's relevant to you. But here are the 19 outcomes measures to choose from. And again, if nothing's relevant to you and your workflow and your specialty, then you can just go back and pick one out of the quality measures. But here are all the outcomes measures to choose from. Because you got to do one if you can under quality and under the quality domain. And again, these are all 19 here. So now, and again, you can just go back and pause if you want to look at the screen specifically. Now, there are 93 improvement activities, and you've got to choose 4 or 2 high-weighted ones to achieve maximum score with this new category of improvement activities. So you can see we have actually the high priority ones, the high weight ones, with an H, a red H next to it. But we have 93 to choose from overall. So kind of walking through this, exactly what my team has created, all these slides here, so you can see all 93. Now, on the advancing the ACI, advancing care information required measures, here are all those. So it all depends. You have, again, if you have a MIPS certified EHR, you have to report on 5. And if you do not have a MIPS certified EHR, then you have to report on 4, and then you can pick one from the larger list. So anyhow, and again, we'll be sharing all this with you, including some of these Excel spreadsheets that have all this information in one spot. So now, what will it take to succeed financially? It's very important. We've gone through the revenue cycle best practices, but again, you can't afford to relinquish any of the money that you earn. Everybody's working very hard, so you want to pay close attention to efficiencies and the nuts and bolts that we can fix today. Eligibility verification, authorization management, optimize your coding, send cleaner claims out, denial management with root cause review and mitigation, and make sure you're being tenacious on your following up with your denials. 100% of denials should be appealed. And close analysis of your payer contracts and variance rates, and setting up KPIs to review monthly. Very, very important. What will it take to succeed clinically? We just went through, but you want to certainly integrate data from clinical and financial sources. This is going to become much more important as you engage MIPS and other alternative payment models. You want to customize your EHR to capture this information at the right time to make your reporting even easier. In dashboards, we set up dashboards, and certainly, again, eClinicalWorks is a great product that we've seen and we've worked a lot with to set up those dashboards, and we can look at the financial metrics, the clinical metrics, and make sure that you're hitting all the targets. And that's one of the services that we provide, is going in there monthly or quarterly and make sure that you're achieving maximum incentive. We set up a monthly scorecard to review clinical and financial key performance indicators, your KPIs, that we've agreed to keep your practice just humming right along, and or your hospital. And very important to address the most in need, because those are the greatest financial benefits to your patients, but then also that can be the greatest financial burden as you take on risk-based contracts. So you want to address those for sure. And care coordination to optimize outcomes, you'll see this more and more as part of MIPS and other alternative payment models, and certainly accountable care as we move into those programs. And you want to make sure you're engaging your patients, you're educating and empowering your patients. A lot of great portal strategies. And if anybody that knows me, you know that I personally believe that all care providers that intentionally and deliberately engage with new payment and care delivery models and create the right partnerships will have more opportunity in the future than they have today. There's more money being poured into healthcare, and it's certainly the opportunity to optimize that for you and participate in how healthcare is evolving. So here's a great series of resources. CMS is a great website called qpp.cms.gov. A lot of that we just walked through is also on their website. We always have these webinars going. We'll have cardiology and radiology and primary care, including OBGYN and pediatrics coming up soon. We're doing another orthopedics one soon. And again, all these presentations will be posted out there on our website as well in the webinar and events section. And then CMS is a great site as well called innovation.cms.gov, where all of these value-based payment models are available in our communities, and they highlight them, the commercial ones as well as the ones from CMS. So with that, Alex, I'm going to turn it back over to you and see if we have any questions from the audience.
Thank you, Justin. We are just at the top of the hour, so let's go ahead and dive into the first question. How do I know if our practice needs to participate in a quality payment program?
Great question. I think the easiest way, and I just mentioned this yesterday in the speaking engagement, if you're a physician, a PA, a nurse practitioner, a clinical nurse specialist, and you bill more than $30,000 to Medicare, or you provide care to more than 100 Medicare patients a year, you are eligible for the quality payment program and the MIPS program. So certainly look into it.
All right, great. Our next question, you said there aren't any outcome measures for us, but we're required to report for one. Can you clarify what we need to do to earn full credit under quality?
Yeah, great question. So there are some specialties, like ortho, do not include an outcomes measure specifically. You can go out there and look at outcomes measures, or you can go out there and look at the quality measures and choose any of the high priority measures, because you have to report 6 measures in quality. So just go out there and choose any other high priority measure. So it's a great question.
All right, and then our final question, we are in a PCMH. I heard we're exempt from MIPS. Is that true?
No, PCMH is not considered an advanced payment model or an advanced APM. So, but you are subject to MIPS, or you probably would be subject to MIPS. So the good thing, though, if you are participating in the certified PCMH, you will automatically receive full credit under the Improvement Activities Performance category of MIPS. So, and if you are a PCMH, congratulations, because you're going to be very well positioned to be successful moving forward with healthcare. PCMH are epicenters to how with care coordination and patient engagement and population health, and really revolutionizing a practice. And so not only will you score well within MIPS, but you're also perfectly positioned for the future of healthcare. So congratulations there. Any other questions?
That's it. Thank you, Justin, and a special thank you to everyone for taking the time to attend today's webinar. It's all about revenue, MIPS, and orthopedic best practices. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you would complete that and provide your feedback. As a reminder, today's slides will be shared in a follow-up email within 24 to 48 hours, and we will also include a link to view the recording of the webinar in case you want to review again or share with any peers. On behalf of iHealth Innovations and our presenters, thank you for joining us today, and have a great rest of your day.
Thanks, everyone.